How does the nursing process change when the world is your client? What do we need to do to protect ourselves, our coworkers, and our families in a global health environment? And most importantly, what do we need to teach for health promotion and disease prevention in a somewhat volatile or sometimes volatile health illiterate climate? In this module, we will explore the answers to these questions. I'm Professor Jordan, and I will be your facilitator as you learn, plan, and operationalize the roles of the global community health nurse. We live in a world that is increasingly smaller. One can get on a plane in Fort Wayne, Indiana, and be in another country by nightfall. Because of this, we have to be concerned about the health of people who live thousands of miles away. Their health status can and does affect ours. An example close to home is the person who attended Super Bowl 49 in Indianapolis. Just think for a minute of the thousands of people who attend events like the Super Bowl. They come from all over the world. So this football fan goes to Indy, does a little shopping in the Super Bowl village, goes to the game, and just has a great time. When the festivities are over, he hops on a plane that touches down in Fort Wayne in order to meet his connections further south. Now, this wouldn't be significant if he hadn't contracted measles prior to arriving in Indy. Needless to say, this particular football fan left a gift that could be tracked across the country by the CDC. Check out the link I posted in Activity 4 to view a 1-minute video that tells you all about it. So, when we talk about global community health nursing, we really mean global community health nursing. When we talk about health promotion and disease prevention through education, screening, and immunization, we really mean that too. Right now, in the fall of 2014, the Ebola virus has center stage. Things have quieted down a bit since the infected healthcare workers have gotten better and there have been no new cases found in the US. But, and this is a big but, who knows when the next scare will happen? What we do know is that a person can get on a plane anywhere in the world and potentially be here where we live, work, and play in less than 24 hours. With some investigation, we may be able to discover where he or she originated from and any possible stop-offs along the way, but that would be after a trail of infectious disease, be it measles, H1N1 flu, or the Ebola virus disease, has been left here and there. What we must not lose sight of is that as healthcare workers, it is our job to be proactive, to be prepared, to provide correct information to counteract the foolishness that many people will spout from ignorance. You are the healthcare professional. You need to be able to talk about the Ebola virus disease, how it's spread, what the public must do to protect itself, and what we as healthcare workers must do to protect ourselves when we are caring for clients with hepatitis, HIV/AIDS, or the Ebola virus disease. We must be the voice of reason, the calm in the storm. And like the American Nurses Association and others who spoke up and spoke out, we must be the voice that advocates for the nurses, for the healthcare workers who care for these clients. What do we know? We know that the Ebola virus disease has been around since 1976. There have been small, minor outbreaks over time, but nothing like what's happening in Liberia right now. Hospitals are full and patients are being turned away from the door. The video I chose for you, Dying at the Hospital Door, puts this in perspective for you. It puts a face on the problem. Instead of the nebulous they, it becomes ibagastiwo. We know the virus is spreading fast among families in the slums. Why there? Why not in the more affluent neighborhoods? Think about the close quarters, the crowded conditions that people in some areas live under. Think about facilities available for hand washing, personal hygiene, clean drinking water, and waste disposal. Think about the 2 or 3 week incubation period, the period when an infected person can be asymptomatic and then possibly spike a temperature later. Think about the hygienic practices that may or may not be occurring. What's different here? What do we do differently that significantly reduces the possibility of such an outbreak? We use universal precautions. We are careful with every person's blood and body fluids because we just don't know what they may be harboring in their bodies. We don't know what they've been exposed to. When more stringent measures are needed, we place patients in isolation, in quarantine. Those who've been exposed to the Ebola virus disease but are asymptomatic are placed on a 21-day quarantine. They take their temperatures daily, and when it begins to rise, they are to seek medical attention. After the 21-day period, if no symptoms are present, they are considered disease-free. To help you gain the knowledge you need to be able to talk and act sensibly about the Ebola virus disease, I've posted several resources and critical thinking activities to help you get up to speed. Activity 2 provides 3 very short videos for you to watch. These videos give you a quick introduction to the chaos that is the Ebola virus disease. Activity 3 is a discussion board assignment that requires you to visit various websites which provide information for healthcare workers about the Ebola virus disease and how we can and should protect ourselves when caring for these patients. You visit the CDC's website, Emory University, the Kentucky Department of Health, and our own Fort Wayne Allen County Department of Health. Each site has something important to teach you. Examine them carefully, then participate in the assigned discussion board as directed. You should be able to discuss how the Ebola virus is contracted, what is different about healthcare practices in Africa that allows this disease to proliferate there, how it's treated, what we need to teach the public to keep them safe, use of personal protective equipment, the rationale for the 21-day quarantine, the impact on community public health nursing, and the recent travel directive issued by the Fort Wayne Allen County Department of Health. You might have seen signs posted on doors at the entry of schools, hospitals, and other agencies. What's that all about? You need to know. What should be your takeaway from this unit on global health? Well, the first thing to keep in mind is that it's about more than Ebola. There are other pressing worldwide health issues. As you do the reading, note the framework or the approach for global community health nursing. Our textbook guides us to think about the 3 Ps: population, provider, and procedure. Figure 16.1 on page 499 directs your attention to these concepts and how these factors may change or shift over time. Look at the universal imperatives of care: mortality, morbidity, daily function, decision-making, and cost. When you look at the population of people in the world, consider the impact of infectious diseases on morbidity and mortality and cost. Ask yourself, how has immunization affected morbidity and mortality rates worldwide? What still needs to happen? What infectious diseases we need to be concerned about most? You might even consider revisiting the infectious diseases module and the video on tuberculosis. Speaking of infectious diseases, measles and polio are 2 diseases the world is working to eradicate. We've made a lot of progress, but there is still work to do. And as we work to eradicate diseases that have long been a blight upon the human condition, we have to be constantly aware of emerging infectious diseases. Take a look at Table 16.1, page 515, and on page 516. What are your thoughts on this? Look at display 16.4, which identifies the leading risk factors for morbidity worldwide. What are some of the same conditions we struggle with here in the U.S.? What's different? The other thing I want you to think about is this. Often, when one thinks of global health, the face of some starving child in Africa pops up. What are the other faces we need to be concerned about? Granted, the problems associated with disease, violence, and women's health are huge in Africa and in other third world countries. But there are other countries who have social issues, health issues that we need to be concerned about. You should be able to discuss a few others. Now, let's talk about the global health viewing and critical thinking activities. When you look at the videos, Johns Hopkins Global Health Initiative and the Doctors and Nurses documentary on healthcare workers, you are introduced to the problems of primary concern: child mortality, maternal and infant health, infectious diseases, and overnutrition associated with exposure to Western lifestyles. You should know why these are global health issues and be able to discuss them. Ask yourself, what are the pressing problems concerned with global health? What do we see in regards to the health care of women, children, and infant mortality? What effect does living in a country with a shortage of healthcare professionals have on health in general and on maternal infant health and mortality and child mortality? The World Health Organization has the lead in addressing global health issues. What is the World Health Organization? Who's in it? Why do we care? How do they collaborate with others to address world health issues? This chapter also introduces you to the concept of primary health care, which is a way of thinking about the delivery of health care worldwide. Figure 16.2 on page 526 addresses primary health care. Note that the foundation of this model is the village or community health worker. This healthcare educator, the community health worker, is gaining status globally, but the model is struggling nationally. Why do you think this is? The evidence-based practice physician versus nurse interventions found on page 527 contributes to the discussion. Now, just so you know, we do have an organization locally that utilizes community health workers. They work out of the Office of Health Visions, an organization founded by the Poor Handmaidens of Jesus Christ. I believe they are under the auspices of the St. Joe Foundation. They do teaching about diabetes and chronic disease management to people in the community. Their goal is to empower clients to be more in control of their health, to be more health literate. There are limits to what they can say and do. They use the Stanford model of teaching, which provides a script for them to work from. So it's very precise. If you want to know more about it, about this particular model, just Google community health workers and the Stanford model. The last topic I want to touch on is sanitation and clean water. Clean drinking water is a must. Unclean water is associated with many illnesses, but in particular, a lot of children die from diarrhea and other conditions associated with the GI tract that result from drinking unclean water. Think about all the ways we use water on a daily basis: cooking, cleaning, sanitation purposes. Speaking of sanitation, what resources for personal waste disposal are available? And how does the lack of appropriate sanitary facilities contribute to illness? Think about the article we read about hepatitis A and frozen strawberries. So, to wrap this up, I ask you, who is involved in caring for the people of the world? What government and non-governmental agencies are trying to do this work? Don't try to memorize all the agencies that are presented in your textbook, but do have an idea about some of the more well-known ones. Take a look at the vocabulary and the learning objectives in the beginning of this chapter and those listed on Blackboard Learn. I suggest you do the reading, or rather I suggest you review them prior to doing the reading and viewing activities. This will prove useful to you as you make your way through the material and prepare for exam 4, which opens on Wednesday of week 14. We're almost done. We've only got 3 more weeks to go. It's a journey, but we'll get there together.